And then it's officially started once you hit start broadcast.
Okay.
The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, and welcome to the PACE webinar number 2, PCORI Merit Review, Your Role in Research Done Differently. My name is Jessica Sand, and I am a member of the PACE project team. Today during this webinar, I will be giving a brief overview of what the PACE project is, as well as what PCORI is, before we begin talking about PCORI Merit Review. I will then hand things over to Corey Jones. Corey is a veteran patient merit reviewer and mentor who will give us the patient perspective of PCORI Merit Review. Unfortunately, Jack Westfall could not be with us today, so for those of you who have questions regarding the physician perspective of merit review, please feel free to send in your questions via the webinar or email, and we can get those answered for you. So I know we have a lot of researchers and students and other primary care stakeholders on the line, and while we will be focusing on patient and clinician engagement today, I want to assure you that the researcher and other stakeholder role in merit review is needed as well. So this topic certainly pertains to you too, and I want to welcome you to the webinar. So with that being said, I would like to take a quick poll of the audience. If I can get it up here, you should see a pop-up box. Hopefully on your screen. If you could choose which answer you best identify with today while attending this webinar. Are you here as a patient or community member, a practicing clinician, a researcher, or a student? And I'll give you a minute to check your answer. And if you're watching the webinar with a group of people, feel free to send a message with all of your answers through the chat function. So while you complete that, I'll just go over a few items before we get started with the presentations. First, we will be recording this webinar and posting it on the PACE website, which is hosted under the NAPCRG site shown here on this slide. Second, we welcome your questions and comments via the chat function found on the right side of your screen. Feel free to send these in at any time, and Corey and I will do our best to answer those for you at the end of the presentation. And if we are unable to address your questions during the webinar, you can email your question to us at pace@napcrg.org. So let me go ahead and close the poll. And see if I can share it with you all. Looks like 20% of you are patient or community members and 80% are researchers. Great, thank you. All right, so we'll get started with today's presentation with what is PACE? PACE stands for Patient and Clinician Engagement. The PACE project is funded by a PCORI Eugene Washington Engagement Award, which was awarded to NAPCRG in 2014. NAPCRG, or North American Primary Care Research Group, is an organization that fosters primary care research in the U.S. and Canada and across the world. And the goal of PACE is to bring together patients and community clinicians to play a lead role in advocating for and conducting primary care research. And we do this in several different ways. We host day-long pre-conferences. We hold webinars such as this one, and through local symposia. And the two photos below are actually from our recent symposium in Denver, where 23 people came together for an evening to talk about engagement in primary care. And for more information about PACE or how to get involved in PACE, again, you can visit our webpage on the NAPCRG site. And before we get into merit review, I'll give you a brief overview of PCORI, or Patient-Centered Outcomes Research Institute. So PCORI is not affiliated with any government organization such as the NIH. It is a nonprofit organization independent of all government agencies. And PCORI funds comparative effectiveness research, and it engages patients and other stakeholders throughout the entire research process. Through this presentation, you'll hear about one of those ways that PCORI does this, through merit review, which is PCORI's process of patient and stakeholder review of funding applications. So in this slide, you can read PCORI's mission statement. And the idea is that by funding research that includes patients and clinicians and other stakeholders, this will help people make better healthcare decisions and improve healthcare delivery and outcomes. So what does engagement look like in PCORI? So these are a few areas where patient and stakeholder communities are involved. If we start in the top left-hand corner, you'll see that patients and stakeholders are involved in selecting topics of research PCORI should fund, and then helping to prioritize them. And then moving to the right, the design and conduct of research, for example, identifying research questions with investigators. Also, being part of the research team, patients and stakeholders are involved in dissemination and implementation of results. And then also evaluation, or the merit review process, which we'll talk about more now. The goal of PCORI Merit Review is to identify applications that have the strongest potential to improve patient outcomes. So we have a short video from our PACE pre-conference in New York City. This is Dr. Sahai Tafari, PCORI's Associate Director of Merit Review. She'll be talking about the expectations of a merit reviewer.
There's a group of people on my team called Merit Review Officers, and that's a group of scientists who actually manage the review process. They look at these LOIs that have been invited by the science programs, and they begin reviewer recruitment based on those topics. So our reviewers are recruited based on expertise. Okay? So, what is the expectation of our reviewers? As I mentioned, we have different types of reviewers on our panels. We have patients and stakeholders on our panels. We have scientists, and we have a chair that kind of facilitates the scientific discussion of each application. So all of our reviewers need to understand our mission and be invested in supporting that mission. So again, this is a place where we ask people to carefully look at the PFA, and the Merit Review Officer goes over the key aspects of each PFA with their reviewers. We also ask that they bring their perspective to the table. So if a patient is on an application, we ask them to tell us, from the perspective of a patient, does this actually satisfy or meet the merit review criteria as defined in our funding announcement? If you're a stakeholder, if you're a policymaker, we want to hear that perspective. If you're a scientist, of course, you're bringing that scientific expertise, and we want to talk about how rigorous is that methodology. Is there a clear evidence gap defined? And if so, is there CER there that's going to address that gap? Okay, so we are looking for these unique perspectives. We're looking for the expertise to best evaluate the applications that we receive.
So to sum up, the expectations are that a merit reviewer will understand PCORI's mission and that they will bring their expertise to the table, whether it be as a patient, a clinician, a researcher, or another stakeholder. And of course, that they will review assigned applications. So this is a graphic of the merit review cycle. The work of reviewers begins where the red arrow is shown here at preliminary review. And the several steps before that are for submission of funding applications. And you can see that the reviewer recruitment is taking place during this time. And during the preliminary review, reviewers evaluate and score applications. These evaluations and scores move forward to PCORI program staff and help them to decide which applications move forward to the in-person meeting. At the in-person meetings, the applications are discussed by all reviewers on the panel. It's directed by the panel chairs, and it provides a final evaluation score for each application. So just a quick note about the in-person meetings. These are 1 or 2 day peer review panel meetings, typically in the DC area, and in-person attendance is required unless specific circumstances such as a disability that limits mobility would prevent you from traveling. And we have another video from Dr. Tafari, and she's going to take us through the merit review process.
Okay, so now we're in preliminary review. Our reviewers have their applications assigned to them. They have started to receive their training. The mentors have connected with their patient stakeholder reviewers. Our merit review officers are working closely with all reviewers to make sure they understand the timelines and understand how to go through the process. So the reviewers are then looking carefully at our PFA and looking at our criteria and making sure that they're looking under technical merit. Is there adherence to our methodology standards? Are we being sure that, are we actually able to identify applications with rigorous methodology in the review process? Is it patient-centered? Is there strong patient engagement? All of our reviewers write a critique for each of the criteria, which I'll go through shortly, and they also provide criterion scores and an overall score for each application to which they're assigned. And then there's an exchange between the merit review officers and those reviewers. Feedback is provided. We just want to make sure that everyone's on the same page about what we are looking for in the PFA. We want to make sure that people are actually clearly expressing their perspective in those written critiques, because those critiques do go back to the applicant, and our program staff also use that information when they're determining their funding slate. So this information is really important. And we also are looking to make sure that the information in those critiques is fair and consistent and based on the criteria in our PFAs. Okay, so there's this back and forth between our merit review officers and our reviewers who are using these merit review criteria detailed here. So we have 5 review criteria. Our scientist reviewers evaluate all 5 of the criteria, and you can see that they are impact of the condition on the health of individuals and population, potential for the study to improve healthcare and outcomes, technical merit, patient-centeredness, and patient and stakeholder engagement. These are our key 5 criteria. And so we really want to know the impact of condition on health of individuals and population. You know, is there actually, what is the potential impact? Can this actually make a difference? Will this matter? Potential for the study to improve healthcare and outcomes. Is there a gap that's being addressed? Is this actually going to, again, improve healthcare and outcomes for patients? Give them the information that they need. Technical merit, is the methodology sound? Is it rigorous? Is it adhering to our methodology standards so that the information that's generated can be trusted and used by patients? Patient-centeredness, I think Dave did a really nice job of talking about this. Are these options that are available to patients, and do they matter to patients? And then finally, but not least, patient stakeholder engagement. Can you show evidence that you are engaging patients and other stakeholders in this process from the conception of the question to the dissemination of the information of the outcomes of that project? Okay. So our patient stakeholder reviewers focus on criterion 2, 4, and 5, potential to improve outcomes, patient-centeredness, and patient stakeholder engagement. But they may comment on any of these criteria should they feel comfortable doing so. So they're not restricted to these criteria. They're just required to focus on these 3.
So I think that's a really nice overview of what the merit review process looks like. And Dr. Tafari also mentioned mentors and training. So I'll give a little more information about that. So PCORI provides a mentor program and training to all of their reviewers. The mentor program is made up of veteran patients and other stakeholder reviewers, and they help reviewers provide feedback and critiques throughout the process. And merit review training is completed online by all reviewers, and it takes about 2 hours to complete. And PCORI also holds town halls and webinars to provide an opportunity for reviewers to ask questions and to speak with PCORI staff. So I have one more short video of Dr. Tafari telling us about the mentor program.
We do provide reviewer training for all of our reviewer types. Scientists, patients, and stakeholders all get training. Some is online-based, web-based. Our merit review officers work closely with all of our reviewers to be sure they understand our process, understand our PFAs. And we also have something that's really, I'm really happy with and really proud of, which is our mentor program. And this is run through our engagement colleagues. Kirsten Margosian, who is a program associate with engagement, does a wonderful job managing this program, working with us to make sure that we are providing our patient stakeholder reviewers with the support they need. And so our mentors are experienced patients and stakeholders who've been through the process. They know what it's like to go in that room for the first time and sit with clinicians and sit with researchers and really, feel a little nervous about speaking up and really sharing that perspective. We're aware that that can be a little bit daunting, and so our mentors are there to help facilitate that, kind of smooth that path, make sure they understand that they do have parity. They are an important part of the review process, and that to be sure that their voice is heard, because that's what we really want in the critiques that they write. We want to be sure that they are getting the message across to our applicants and also to our program staff based on their evaluation of the applications. We want them to have a good time too. It's fun going to Merit Review. You learn a lot. You get to talk to a lot of different types of people, and we want to make sure that they're enjoying it so they come back and review with us again.
So that's a great segue to our next presenter, Corey Jones. And Corey will be telling us about her experience as a patient merit reviewer and mentor. So Corey, I will hand things over to you.
Thanks, Jessica. Hi, everyone. My name is Corey Jones, and as Jessica said, I am a patient reviewer with PCORI. I am also a mentor and an ambassador. But I was going to start with how I got involved with PCORI. So when we say patient reviewer, I just want to highlight that the patient reviewer also includes a caregiver or somebody who might be associated with advocacy work. In my case, I am the caregiver to our youngest daughter. My husband and I have 3 children, ages 7 to 4, and 4 years ago our youngest daughter was born, and it became clear that she had a rare chromosome disorder. And so to give some insight into my professional life, I have worked at the University of Michigan Health System for, at that point, 8 years, and I know that we have 3 arms: clinical, research, and education. And so when Ava was born with this rare genetic de novo change, so neither my husband and I nor I are carriers, I thought, oh, well then we'll research the condition and we'll find something to help the genes. And that's not the way that research works, apparently. So so I learned very quickly that Ava's she doesn't have a syndrome. Her condition is so rare that she was not going to probably ever be, quote, researched. So I threw my energy into getting involved with patient family-centered care, because if I couldn't change things for Ava directly, then perhaps I could have a more global view and change things within our health system to better engage our patients and families. And out of that work, I was led to a conference where I first learned about PCORI back in 2012. And patient-centered outcomes research, I thought, sounded great. There are outcomes that I would like to have researched, not necessarily for Ava's genetic condition, but possibly some of her symptoms. Someday, maybe someday something would be researched for Ava. So the more I got to involved with PCORI, I realized that, getting involved in research at a patient reviewer level is really a broad, I needed to have a broad hat. I needed to not only be concerned about pediatric conditions, but, about health outcomes for all patients. And so I reviewed one of the first cycles in 2013, and what I saw then was that was really the second cycle that PCORI had included patient reviewers. And I don't think researchers are used to that. I think it's a new way of doing research. And so in the beginning, I was very nervous. I don't have a research background. Although I worked for a hospital system, I didn't actually do research. And so I was pretty nervous coming to the table. But I also understood that my hat was to look at things from patient engagement. Is it something that patients care about? Is this a study that's designed that patients will actually sign up and participate in? So, while the research idea sounds great, if you can't get patients to sign up and be study subjects, then it's not going to get the data that we're looking for or the outcomes that we're looking for. So I learned to I went into the review wearing that hat and understanding that while I don't know all the biostatistics and the methodologies, I do know what patient engagement looks like. And in that early cycle in 2013, I think there was a little bit of thinking from a patient that I'm going to have to advocate for my seat at the table. But it was really warm and friendly, and I think that the thing that I took away from that cycle were that the scientists in the room were open to learning about what patient engagement looked like and how it is reflected in applications. And so when I think about that cycle and then I move to now where patients were really teaching the scientists really what patient engagement looks like or doesn't look like, now in cycle and panel conversations, I hear scientists actually weighing in on engagement and whether the research question is patient-centered. And so it's been a nice shift to see that everybody is partnering together. So I'll move on to why you should become involved with PCORI. I think that I know that there are a lot of researchers on the call too. And so for the patient standpoint, I think that this is an excellent opportunity to influence how patient-centered outcomes are done. As I said before, I think it's an excellent way to ensure that questions and research that matters to patients are getting asked and brought to the table. And I also think it's a great way to make sure that these studies will actually be successful. I know that our clinical representative couldn't be on the phone, but from the standpoint of a clinical stakeholder, I think that it's an excellent way to influence, you know, is this actually feasible to do a study in a clinic site? You know, can the clinician actually gather the patient-reported outcomes that this application is saying that they will gather? So I think that having the voice of a practicing clinician is crucial to successful research. And for the researchers on the phone, I think that it's a chance to sit at the table and talk about how you do involve patients and other stakeholders, payers and clinicians into your work. And so I think that that's how great patient-centered outcomes research will be done. I also think that it's important to remember that PCORI really calls on the expertise of all of these different areas, and so you know, your quote job is to really go in wearing the hat of your expertise, and it's amazing to hear the different voices around the table at Merit Review, and I've really learned a lot along the way. So I know I talk really quickly, and I hope I answered a lot of the questions out there. So Jessica, I can turn it back to you.
Great. Thank you so much, Corey. So this presentation was a very high-level overview of what Merit Review is. You can find much more in-depth information on the PCORI website listed here. Also, we hope that you all consider becoming engaged or more engaged in primary care research. And if you think that Merit Review sounds right for you, I've included the link to the application here as well. Also, as I was reading through the slides this morning, I realized I didn't have any information on the compensation, so I added it here to the end. You can see that new PCORI reviewers receive $50 for each application they review, and a $200 stipend for each day of the in-person Merit Review meeting. And returning PCORI reviewers receive $75 for each application reviewed, and the same $200 stipend. So we'll take questions now. If anybody has any questions, I think if you are interested in Merit Review and maybe you have some doubts or concerns, I think Corey is a great resource for you to get those questions answered. So I'll just take a minute or two for if anybody has questions to go ahead and type them in. So Corey, what would you say to those patients or possibly clinicians who this sounds really interesting to, but they're a little concerned that they wouldn't have anything to offer, or they don't know enough about primary care or health to sit at a round table with researchers?
So I would say that there is an application process, when you apply to PCORI. And so if you ever had any questions, I think, and wanted to chat it through with somebody, am I the right fit? I think I would absolutely be happy to talk to anybody, but I also think that PCORI staff would be happy to talk to those who are sort of on the fence about applying to become a reviewer. I think, though, that if you, so there are populations of patients that PCORI is most interested in including in research, in women and children, rare diseases, and those kinds of things. And so if you are a patient or a caregiver or a clinician in any of these areas and can wear a broad hat, I think that you are a good fit. I don't think that you need to know all of the ins and outs of research by any means to be able to come to the table to speak to this. Again, I would say the scientists are there to talk about the research methods, and the patient is there to talk about, yes, patients would engage in that, or no, patients were not engaged in that. And so you each have your certain expertise that you bring to the table. So while I understand it can be intimidating, I will admit for myself, I have been a participant in a study, or my daughter has, but I have never actually gone through the research process from start to finish. So even my own experience is not directly research related, it's patient engaged related, if that makes sense.
And Corey, can you tell us a little bit about what a review looks like how many people are in the in-person meeting, and what goes on during that time?
Sure. So, so we saw the wheel of, can we bring up that slide again, the whole process, the wheel that you showed of the process? So while the researchers or applicants, and again, all the applicants should be including patients and clinicians and other people in their application. So for instance, if you're a clinical stakeholder or a patient reviewer, you're not just reading a solely written application just by a scientist. There should be clinical stakeholders and patient stakeholders who have contributed to this application. So you would get assigned a reviewer, and each application is reviewed by 2 scientists, a patient reviewer, and a stakeholder reviewer. And again, patient means patient, caregiver, or advocacy group, where the stakeholder might be a clinician who does some research, or a frontline, I call them frontline clinicians, but practicing clinician. It might be a payer or from one of those other stakeholder groups. And there's a lot of information on the website that kind of tells you who fits what role. And so when you go to merit review, so you do all of your written critiques, and then you go to the in-panel meeting, and it typically looks like we made a video that they use to train, but it looks sort of like an open, like a horseshoe, if you will, and there's probably 20, there might be 20 people sitting there. It's usually a certain number of patient stakeholders and a certain number of other stakeholders, and then probably that number together of scientists. But again, scientists many of them are practicing clinicians. So it really is a very productive and friendly, non-intimidating conversation, if you will.
Great. Thank you, Corey. And if there's any other questions, I'll just give it 1 more minute for any other questions. Oops. And if not, or if you would like to send your questions or comments to me, you can send them to pace@napcraig.org. So that's all the time we have for today, and thank you for joining us. Also, please take a moment to complete the evaluation of this webinar. You'll have the option to do so directly after we finish. And have a great day, everybody. Thank you.